Hi, what I want to do with these videos is expand on some of the concepts of the book, or do them by video blogs so that you have maybe a different understanding. Maybe not a better understanding, but a different understanding, because if we can, the more ways we can get information into the brain, the easier it's going to be for you to grasp some of these concepts and precepts of what I'm talking about. If you have my book, Noticing Fixes More Than Fixing, there's some charts in there. They're not mine. I acknowledge in the books that they're developed by a man named Martin Sage. But there are two areas, two different operating systems, what I call the pristine operating system, or the one that you came operating on, and the enculturated one that seems to be a little less than efficient. I think the most important thing is to be aware of where you are in either of them. It doesn't matter, but if you can see what you've been enculturated to and what you've learned, and then you can move out of that if you want to or if you need to. And this evening we're going to talk about compassion and caring. And caring, the definition I'm going to use is one of anxiety or worry for another person, where you are looking for something to change for them. You've judged them and you think that something should be different, and it causes you and or them worry or anxiety. Compassion I'm going to utilize kind of like how babies are towards you. They're compassionate. They love you unconditionally. For the most part, a baby will go to anybody. When we had babies, I would watch them when Lydia was just an infant, maybe a couple of months old. We would go watch my son's baseball games, and she would be passed throughout the bleachers, just loving everybody. And I would watch every mom that held her change to a more compassionate state. So that's the compassion we're talking about. To the physicians out there, what it meant for me was 20-some years ago, was I failed to make that distinction between care and compassion. A lot of my patients I cared about and thought that if they rambled about their problems, that was being caring. And it was being caring, and it was being inefficient. And I had no capacity to stop them, or willingness, because I thought I was being a good doctor. Nobody taught me how to be a doctor. We don't learn that in college. But I would listen to people complain and talk about their lives, and when I started to make the distinction between compassion and caring, between loving them completely for who they are or letting them run on with their shit, it made my practice a lot more fun, because I could start to watch their vitality. And if their vitality diminished, and if I watched the boring, monotonous stuff that they talked to 1,000 other people about, and it was just another person to tell their same boring, horrible story to, I then learned how to be ruthless around my compassion and my happiness, and say to them, stop. You've told enough people that. I don't want to hear about that. I want to hear about what you want to get out of this meeting. And I want to get who you want to be, not who you've been, and not through all the turmoil and clouds and all the other stuff that you're talking about and all the problems with your family. There's nothing I can do about that. But if we can look at where you want to go and who you want to be and what you want to create out of this session, then we can get effective in your health care. So we would stop with the problems. We would stop them talking about their problems if they talked about them, and I was working on them at the same time. Sometimes I would let them ramble because it didn't seem to make any difference. But for the most part, I could stop and say, okay, what do you want to create out of this session? What would be the optimum? Why did you come to me? Why are you spending this money? And it became then like a chess game. A lot of them say, well, I don't know. And I say, well, you must know. Well, I'm in pain. Okay, I know that. But what is it that when you're doing it, you're out of pain? Well, I'm always in pain. I don't think so, because very rarely are we always something. And I was working in Australia last year, and a gal was talking about noises in her ears, and she was saying they're always there. I said, I don't believe you. And she said, no, they're always there. And I said, no, I don't believe you. And I wasn't calling her a liar. I just know from experience nothing ever is always. So I talked to her, and I finally said, okay, in the middle of an orgasm, do you still hear this noise? She said, well, I don't know. And I said, you don't care either, right? She said, yes, I presume it's still there. I said, you would have to presume that, but I'm going to presume it's not there. Right? If you can learn a few tips to talk to people on how to, if they say, I'm always, that's not a true case. Look for when they're not. If they're always in pain, look for when they're not in pain. Look at what is it when they're doing it that their life is working, that they're having more fun. Know one thing through your compassion, that you can love them unconditionally. One, because you may not see them very often, so therefore you don't have to dislike or judge them. You don't have to care about them. You don't have to carry them around. If they get better, that's their doing. If they don't get better, that's their doing. And as I matured in practice, that became an essential and a fun way to work. People would come back in, I would say, what's different? What value have you created? What have you noticed is different? I had a man here in Switzerland. He came, and on the third visit, I said to him, you're going to have to go someplace else. And he said, what? I said, I'm not getting any results. And he said, what? And I said, you keep complaining about the same things over and over again, so I must not be getting results. We must not be co-creating an experience that's better for you. And he said, well, where else am I going to go? And I said, well, you've told me your only other option seems to be surgery. I don't want to go for surgery. And I said, okay, the dilemma is you don't seem to be responding to care. When I stopped his world and let him know, all of a sudden he went on a whole different channel. He looked and he said, wait. Since I've been coming here, there's a lot less pain in my leg. He said, I'm complaining because there's still pain. He said, but I see what you're saying. There's a lot less pain. There's the numbness is significantly different. There's a lot less numbness. He said, I can lift my foot actually where I couldn't before. And he started, and that's where we kept our conversation going then. Every time he would come in, I say, what's different in a positive way? What's moving? Because the mind has a tendency to go to the lowest common denominator and make us sure that things are the same. If you go through any sort of transformation, you presume that's who you've always been. If you start to get better, you presume that's who you've always been. So you have to work with the patient to look and see, okay, where are you? What do you want to do? And where do you want to be? Thank you very much. My book is Noticing Fixes More Than Fixing. My website is www.micpeakperformance.com. Have a fun day. Love you.